Hi, I'm Andy Haggard from the Central Ohio Area Agency on Aging. Welcome to our series, Medicare for Beginners. In this segment, we'll be talking about financial programs available to help Medicare beneficiaries. Before we begin, here is a brief overview of Medicare. What is Medicare? Medicare is a federal government health insurance program. It provides coverage to persons who are age 65 and older, younger persons who may be receiving Social Security disability benefits, or persons who have end-stage renal disease requiring dialysis or a transplant. Medicare recipients must be a U.S. citizen or an individual lawfully admitted for permanent residence who has resided in the United States continuously during the 5 years preceding the month of the application for Medicare. There are two options for Medicare coverage: Original Medicare, which includes Medicare Parts A and B, or Medicare Advantage. There are additional video sessions like this one that provide information about Medicare B and Medicare Advantage. In this segment, we will discuss programs that can assist eligible individuals in paying costs that are not covered by Medicare. These programs can help regardless if the beneficiary has Original Medicare or a Medicare Advantage plan. There are two such programs that we will discuss. One is Medicare Savings Programs. They can assist with costs associated with Medicare Parts A and B. The second is called Extra Help, and this assists with costs associated with Medicare Part D. We will look at who is eligible, how these programs work, and how to apply. First, let's talk about Medicare Savings Programs. Eligibility is based on an individual's or a couple's income and assets. As mentioned before, these programs can pay all or some of the costs associated with Medicare A and B. There are different levels of assistance based on income. Qualified Medicare Beneficiary, or QMB, acts as a free Medicare supplement plan that also pays the Part B premium. Specified Low-Income Medicare Beneficiary, or SLMB, pays the Part B premium only. Qualified Individual, or QI, pays the Part B premium only, and there are a limited number of spots. The Ohio Department of Job and Family Services is responsible for eligibility and enrollment. An individual can apply by calling the Ohio Medicaid hotline at 1-800-324-8680 for information and assistance on applying. Individuals can apply at the local Job and Family Services office or online at www.benefits.ohio.gov. If a beneficiary is eligible for one of these programs, they are also automatically eligible for Medicare Part D Low-Income Subsidy, also called Extra Help. Eligibility for Extra Help is also based on an individual's or couple's income and assets. If eligible, the benefit will be automatically applied to whichever Medicare Part D prescription drug plan the person has, whether it's a standalone plan or through a Medicare Advantage plan. If eligible, the individual would have reduced or no deductible and reduced copays for prescriptions. The Social Security Administration manages eligibility and enrollment for Extra Help. Apply online at www.ssa.gov or by calling 1-800-772-1213. To learn more about Medicare, we invite you to attend one of our free Medicare for Beginners workshops held monthly at COAAA. Look for other segments in this series where we will discuss the other parts of the Medicare program. There are also resources on our website, www.coaaa.org.
The Central Ohio Area Agency on Aging supports people as they navigate the experience of aging or disability. We connect people with services that help keep them safe and healthy at home, such as homemaking assistance, transportation, home-delivered meals, and personal care. We offer education and resources to caregivers, professionals, and the public, and advocate for programs and policies that benefit older adults and individuals with disabilities.